So here at the Rehab Hub, we see many clients and patients come in with many health conditions. This one that we're talking about today is multiple sclerosis. So I wanted to go through can Pilates help with that, what we have on offer at the Rehab Hub. Now, I should say we are a team of healthcare professionals and Pilates teachers. So what that means is that we're in a kind of unique position where we've got everything under the one roof, from physiotherapy to podiatry to the rehabilitation through the utilisation of Pilates as a tool. So before I go on, I just want to go over a little bit about what MS is, and it is a condition that affects the brain and or the spinal cord, and it causes lots of different types of symptoms, including things that may affect your vision, your arms, your legs, movement, sensation, and balance. Now, some of the symptoms that different patients find themselves getting with MS, and these are not exclusive, and not everybody will get these. It is very varied and different. Fatigue, difficulty walking, that loss of balance, loss of movement. And this is really where the podiatry and physiotherapy sides of what we do in here and linking that into Pilates really can help. Blurred vision, the vision problems because of how MS attacks your nervous system, essentially deteriorating the myelin sheath. And we'll go into that a wee bit later in this presentation. But effectively, if you imagine those signals from your nervous system are just basically are having difficulty getting to where they need to. So signal getting out and signal getting into the spinal cord of the brain. So, and that can include that optic nerve. So essentially vision problems, problems in controlling your bladder, numbness, tingling in different parts of the body, muscle spasms or stiffness, balance issues, coordination problems with cognitive thinking, learning, just being able to kind of get your brain functioning. And depending on the type of MS you have, your symptoms might be something that kind of is there all the time, or they may come and go. So we said there's a couple of different types of MS, and generally it's usually kind of described in how a person relapses. So someone with relapsing MS will have episodes of new worsening symptoms known as relapse, and these are typically worsen over a few days and can last for days or weeks or months, and then slowly improve or over a similar period. But again, there's no exact time frame with these, and the relapses often occur without warning, but usually there is an association with stress or some sort of illness. It is an autoimmune condition, so and that basically just means that something goes wrong with your immune system, and your immune system attacks the myelin sheath, so it attacks the brain or the spinal cord, the brain or spinal cord and spinal cord, it could be, of the nervous system. So essentially what MS is doing is it's attacking the layer that it surrounds and protects the nerves, and that's called the myelin sheath. And it damages and scars the sheath and potentially the underlying nerves that are underneath that. And then this disrupts those messages traveling along those nerves. And that can mean that they either are disturbed or slowed down, or they actually stop going through at all. So this is an image on the left is of a normal nerve cell. And you can see that kind of normal myelin sheath. Then you can see what an MS nerve sheath cell may look like, and you can see that damage to the myelin sheath. Now, can Pilates help with this? Now, I should say there is no cure to MS, and yeah, there is no cure. However, that doesn't mean that you just lie down to this. There are things that you can do. So if you're watching this, or somebody you know, if you've got MS, there are things you can't do. This isn't just, that's it. Pilates and physiotherapy, podiatry intervention can massively help you. It can help you manage your symptoms, but with MS, it is about this consistency. It's not about doing big workouts, big long workouts. It's the consistency of your workouts. So it's trying to get Regular activities every day. So, for example, with Pilates, if you're coming to us, you're generally coming in and you're getting the reformer with us. Now, it wouldn't be realistic to say to come in every single day. Let's be sensible with that. But it would mean that working either with us or elsewhere, you really need to be doing some sort of very base program that you're able to do every day. And it might only be a couple of exercises. It's not going to be long, but it's that consistency of doing it. And that's really important with MS. So you can see here I've got even doing a few exercises regularly can really make a difference. Some of the symptoms that Pilates specifically can help with is things like drop foot. So that's where the foot, the anterior nerves on the front of your leg, essentially you're unable to clear the ground and you lose the strength, the ability for that to contract and lift up. So that has a whole host of problems with your walking, which you can imagine has a whole cascade of things that can go wrong there. And when things are going wrong down at the foot, so I myself am an MSK podiatrist as well as a Pilates teacher, and this is a symptom we see a lot, and that has an effect not only in the feet, but when you have things going on down at your lower extremities, then this will affect everything upstream. I almost like to describe the feet as like the foundations of your structure. So think about it like the foundations of a house. Things are going wrong down there, then you're not going to be in a stable structure. Posture, overall general posture, we tend to, with the MS, get more of a kyphotic, rounded posture that can give you various different symptoms, things like pins and needles, loss of sensation down the arms, loss of could be even loss of function of arms. It could be weakness, spasms, and yeah, it's important that overall your posture and you're continue to keep yourself moving and strong and mobilised as much as you can. Bladder. So again, there, incontinence problems there. So these are all things that we don't really always think about or really talk about, but think about how debilitating, how limiting just that is, and there are things that we can help you with. So as part of Pilates, breath work, calming down the nervous system, getting that mobility, freeing up the joints, helping the signal from the nervous system get to the associated structures and muscles. But again, with that, bringing in your pelvic floor with breath and changing the intra-abdominal pressure, all of this is part of that. So getting that awareness in yourself and support and help with that really can be quite valuable. A big symptom for many people with MS is the fatigue. It just is chronic, and it is so difficult to motivate and force yourself to get up and do something when you just feel absolutely exhausted. But having said that, doing regular exercise, having regular support and consistency with that will help with that fatigue. But it is like a catch-22. If you break that cycle, you don't get into it, it's so hard to get out of that. So it's not easy. It's not easy, but it can absolutely help you with that fatigue. And I know that sounds a bit counterintuitive. How can doing Pilates, a form of exercise, help you with something if you're absolutely exhausted? How's that going to help you? But trust the process. It does. It gets things moving, gets you breathing more, calms down the nervous system, strengthens you up. All of these things are going to help you. And finally, memory, that kind of brain fog and things. So big part of our rehabilitation there is working with the nervous system. So like the Rehab Hub here in Glasgow, we'd be bringing in things like coordinated movement, working on the refined motor movement. So we might be doing some cerebellum retraining, so just getting different, tapping into different parts of your brain. So generally, if we've got MS clients in our sessions, whether that be semi-private or in the group classes, because you're absolutely fine as long as you're safe and able to. We've got no problem with people going into our group classes as long as you're safe to do so. But what we like to do is build in that coordinated motion and movement and building that refined motor movement. So specific things like neural loading, so building up that cerebellar training as well. So we build all this into the programme. In terms of how you would get started, so if you are listening to this, watching this, reading this, seeing this, wherever you are seeing it, we are based in Kinning Park, and it's quite a large facility we have. We offer, probably alluded to a little bit there, we have a large clinic there where we have health professionals. Those health professionals are in the form of physiotherapists and MSK podiatrists. We also do routine podiatry as well, so for normal things. And MS is a condition where your immune system, you'll generally be on some sort of possibly immunosuppressants with this. Just depends, everybody's different. You may be getting steroid treatment with this, and as part of that, you tend to be more susceptible to even things like verrucas, fungal nails, these kind of things. So I know that doesn't, maybe it doesn't sound like much, but actually when you've got it, it can be quite sore, it can be quite embarrassing, and various things like that. So these are all things that we can help with. So we've got the full physiotherapy and podiatry clinics there, and as I said, we have the rehabilitation. Rehabilitation we use is in the form of Pilates. We offer reformer classes, so reformer with just the reformer bed, but we also offer what's called half tower or half trapeze, and that is utilising it basically looks like a reformer bed, but it's got other attachments to it. We are a fully equipped studio, so we have the ladder barrel, window chair, so we have everything there. We have the spine correctors there, we have all the props, everything that you possibly need to really get the benefit from the works. The teachers that work here and the other health professionals that work here are very well experienced. For example, Sarah, who works here, she's worked with us over 10 years. She has her Masters in Sports and Exercise Science. She is a lecturer of sports and exercise at local colleges, and has been teaching Pilates now, I would want to say, over 30 years for Sarah. Myself, I have been teaching Pilates 24 years, maybe 25 years now, and also a master trainer for teacher trainers. So we mentor a lot of teachers here and teach them. We are also creator of the clinical Pilates method, where we teach postgraduate training to Pilates teachers. So you can rest assured you're in good hands with us here at the Rehab Hub in Glasgow. Go and check us out. Go and look at that. We definitely, you're going to be in the best of hands. And in terms of getting started, what we would generally recommend with something like this is that you book a clinical, starting. And I'll put the links with this video, but essentially what we wouldn't want you doing is just going straight into the beginner's course. We do the beginner's course. Everybody that comes with us, you don't just come in and do classes with us. Everybody's going through some sort of individual training before they get advised where they need to go. But if you've got something like MS, it is worth doing the clinical side, starting with that. And that would involve a gait and posture assessment first, but more vitally with that, so it's a thorough 3D movement analysis. So we are affiliated and linked up with Oxford University Spirit Company that's called Run Walk 3D. So we have a full gait lab that's at research gold standard. Nobody else in Glasgow has that. It isn't available anywhere else, and it is the gold standard of movement analysis. So what we do with that is we are able to see exactly how you're moving now. And that, for someone who's got MS, is a really vital thing, because we're able to monitor. And getting every 6 months or twice a year, getting a movement analysis, we recommend if you've got MS, because we then have where you're at that start point, and we can then from there build out what your requirements are, what you need, what you're able to do, what you're struggling with. So we know when you're in sessions, whether it be one-to-one sessions with us, small group sessions, or the larger classes, we know where you're at. So we've got a very small team, so we're all knowing exactly where you are and what your needs are. And we recommend with something like MS that you're getting regularly screened with your movement analysis, because it can be quite insidious and can just creep up on you. So keeping an eye on that, and we then are able to monitor that, and that can build into your case history for going back to your consultant. But also it means that we are seeing, here is where you were 6 months ago, here is where you are now. Hopefully we're getting you stronger, hopefully we're keeping you mobile and moving. So it is quite a unique opportunity that you have with us there, where we can monitor this going through. So we generally would recommend that is where you start with this, is the clinical side. So you get the gait and posture assessment, you've got that objective data there, and we can build out exactly what you need. And we would definitely recommend that you do that, especially with multiple sclerosis, that you get a gait and posture assessment every 6 months, so that we are keeping tabs on that. We're keeping a close eye on your gait and how you're walking and your muscle strength testing. So I should say, with that assessment, we are testing all your muscles. We're actually getting objective data and actually quantifying how strong you are all over your body. So we're not just guessing like, oh, I'm feeling a bit weaker. We're actually going to be able to objectively say, yes, today you are at 6.4. Last time you were at 4.2 or whatever it is. But we've got that data there. We can actually quantify that. So it's for MS. It would be something, if that was me, that's the kind of gold standard I'd be wanting. So we have that facility there. So that's how you would get started, and we would be best able to advise you from there. I hope that's maybe answered some of your questions. We've got quite a few people that have made contact with us, so hence this presentation specifically for MS clients. It's quite important that we kind of make it clear where you start, what you should do. I should say we do have the full clinic there. We've got various options for looking after you and helping you, obviously with that breakdown of the myelin sheath, possibly more inflammation in your body as well, which will increase things like pain, and possibly more degeneration. So what we also have is obviously the physical therapy, but we also have magnetotherapy and laser therapy, which both would be indicated for multiple sclerosis. So these are things that we can really help you keep as much as you can, as revitalised, keep your well-being, keep that self-care, keep your stress levels down, and hopefully keep you out of relapsing, and keep you moving and a good quality of life living with MS. Thank you for listening, and